The vision for the updated health strategy is so that all New Zealanders live well, stay well and get well. The reason for the change is that it's been 15 years since the last strategy was released and many things has changed during that time. The direction given in the strategy will help all of us to actually focus on the direction of travel and so that we are unified when we look at how we need to respond to the challenges we face in the future. The fundamental thing about the refresh strategy, it not only articulates 5 themes in there, but the more important thing is not just the theme, but how we are all within the system changing our mindsets and behaviors in responding to the themes. And that's really important because the document can only become a reality if there's a mindset change and there's a behavior change from all of us throughout the system. One of the big themes around the mindset change is about how we need to work with other participants in the system. And what I mean by that is colleagues from education, colleagues from Ministry of Social Development, colleagues from housing, colleagues from the justice sector, as well as colleagues working in local government, NGOs, and even the private sector. I know that this has already been done in the sector by some organizations, but what the strategy clearly articulates is that this needs to be the norm as opposed to the exception, and I look forward to an acceleration of that right across the sector on this particular theme. But in the end, I think that what we really have to think about in terms of the actions we will take is to actually remember the words of needing to care in the first instance, as opposed to focusing on just the health part of the healthcare equation.
The health strategy is the whole team health approach to improving the status of the population in New Zealand. We need a pathway and a plan to go down that track, and we've got to work together on it. The strategy gives us an understanding of the needs of the population for a start and our communities. We need to understand our population, we need to understand their needs, we need to understand what it takes to actually get an improvement in the health of our community. And we can only do that together. The district health boards are only one component of the New Zealand health sector, but they are an important component and they need to work with other components of that sector to get that improvement. What makes us healthy or unhealthy is not the health system per se. It is a whole lot of different things that can be influenced by the council, can be influenced by education, can be influenced by social development. And it's a matter of all concentrating on finding solutions for children and for families. So if we find a child that needs to be supported in having breakfast before school, special education needs to be immunised, needs their teeth fixed, needs to have their accommodation or housing sorted for them, then we can work together on finding those solutions. So it's a great opportunity.
People-centred care means putting the patient right in the middle of the health equation, and it means taking the focus off the hospitals and into the home, which is where people live, it's where they have their recreation activities, which is where their family is around them. And so we want the focus to be on the person in the home, and we want to focus on health before sickness, so we want people to maintain their health for as long as they can. But when they become sick, we want them to be able to direct their own support and their own care. Well, first of all, we need to talk to them as equals, as partners in their care, not with the doctor-patient relationship where the doctor has all the power historically, but we want to redress that and put patients and families back in charge. We want to know what matters to them, not what matters to us as a health system, but what matters to them and how we can wrap the services around them in the setting which is most appropriate for them. We ask patients and families for their opinions about the services we offer. There are online surveys and paper surveys. We have focus groups where we interview patients, and we bring patients and families with us now to co-design our services. So we're thinking about the service delivery from the patient's perspective and the family or support person's perspective from the health worker's perspective. And then we can develop the service and test it with patients and families and then roll it out. Well, the hospital staff have embraced it because it's so rewarding working with patients and families and seeing what really matters to them. When we start to have conversations with patients and families about what really matters to them, those conversations count. The health strategy signals a new direction for us, and it needs to be a document that appeals to both our communities, the patients and their families, but also our well communities, as well as the clinicians and providers of health care. So it has to embrace the direction of travel that we think will make the biggest difference to the health of New Zealanders as a whole. This is not a document merely for economic purposes. It's actually about getting wellness into our communities and maintaining it.
Our population is basically 36% Māori, 34% Pacific, and 17% European, and then we have a number of Asian and migrant groups. So it's different, probably unique in the country. We have a large 70% of our population either have a chronic condition or are heading towards a chronic condition, diabetes, obesity, two in particular, and of course they're linked as well, and with CVD issues, respiratory issues, and so we have to do things differently, and we have to be close. Well, I think the close at home is really about knowing who your people are, and also knowing who your service is. And if you can get that understanding that we're here to help, and that we will do it in ways in which is more accessible to them, then that's best for both the provider, and it's also best for the community as well. And so that's the reason why, right from the beginning, we've had a program of trying to create opportunities for our patients so that they can come here or to any one of our medical centres, and we will provide workshops to address their issues and to give them a better understanding. We've done a lot of value-added stuff, like we have a free gymnasium, for example. We run, daily programs in which people can come along and improve their mobility. If you're an elderly person, do muscle strengthening to prevent falls. For young people, we run CrossFit programs, and that attracts them into the service, that they get the opportunity to use our gym, and we get the opportunity to tell them more how they can engage better with their health and with the service.
I'd come down every morning for a half-hour workout just to get the bones and the body going.
I like to think that we're making a difference to our population group. Our most important thing is getting people to understand that if they do have a health issue, then they and us, we need to work together to address that issue to make their lives better.
So when I think about one team approach, I think about the care that my mother received through a hospital in New Zealand, and the complete seamless integration from her referral to a specialist, through to very complex surgery in hospital, through to a long stay in hospital, through to the hospital liaising with other services that she was going to need once she left hospital, right through to being back in home and a large NGO in New Zealand needing to provide seamless transport services to transport her regularly back into hospital. So volunteers transported her back to hospital. They made sure she got to the right place in the hospital. If she was in the wrong place, somebody in the hospital took her to the right place and she was delivered back, and through a kind of seamless execution and the provision of home and community services to support her to be well, get well, stay well and recover at home worked very nicely and neatly. So to me, that's an example of what I think is really desirable in the healthcare system. And if we could provide that really seamless integration that made it easy for an older person to navigate the health system with a minimum of effort, I think that's really desirable. I do believe that it's not only systems that prevent things from happening like this, it's actually people's attitudes. anything can happen if people have got a will to make it happen. So person-centred care is going to be really important for the future, with a growing number of baby boomers who have high expectations of the world as they grow older and live for longer.
Well, information needs to follow patients. So we often have situations where a patient is going off to see a specialist or through to the hospital or coming through to see us, and to manage them you really need information, and having connected systems lets you treat the patient appropriately with those tools. Well, I think the main thing that we're doing here, which we're certainly promoting more widely, is the use of patient portals. So that's where patients can log on, see their own health information, see their results, order prescriptions, message their GP or nurse. It's a nice way of fostering the relationship between the doctor and the patient. I think the reality is that any change can make people nervous, but we don't get a lot of emails coming in compared with, say, the number of requests to phone someone or little notes that are left through the receptionist. So it's another way of doing what you're already doing. And when you look at how often patients log in to see their results, there's a ratio of about 10 to 1. So they're using it a lot. They've been universally very positive about the portal. A new innovation we've got with that is the app for mobile devices, and they really enjoy having that accessibility. And I think looking forward to the future, more and more stuff is going to be on mobile platforms. So we're up to about 30 to 35% of adult patients are using the portal, of the ones who have email addresses. There's a certain population who aren't particularly interested in it, and it's not the elderly. It tends to be the younger, healthy people who don't really have a great need for it. You tend to find that it follows people's needs. If they think they've got health conditions that need monitoring, they'll sign up for it. We know that computer algorithms can often come up with better decisions around relatively simple stuff. For example, warfarin dosing to thin your blood, or managing your diabetes with insulin dosing. So that gives us more time to talk with the patient about what diabetes means to them, or why are they on that agent that thins their blood. So it gives us more time for communicating the meaning behind it to the patient. I'm looking forward to the health strategy and to see what's coming next.